My name is Lynn Pannen, and I'm a nurse and an expert in dealing with elder care issues. Today we're going to talk about the ABCs of Medicare. Well, what is Medicare? It's a health insurance program for people over the age of 65, for those people who are under 65 years of age and have certain disabilities, and for any person who has end-stage renal disease that may require long-term dialysis. This is a federal government program and has been going on for years and years. Medicare has certain parts to it. Part A is the hospital insurance component. This is the area where Medicare will cover a patient being in the hospital. It will include critical access hospitals, inpatient rehab facilities, and long-term care hospitals. So let's say we have a patient who's in the hospital and needs to go to rehab for ongoing services. Medicare will definitely cover that. Secondly, in Part A, Medicare helps cover a skilled facility, or as we also know, a nursing home. These are not custodial or long-term care. In other words, Medicare will cover the costs of a skilled nursing facility if the client continues to improve. Once the client does not improve or is not eligible under the certain health care requirements, then Medicare cuts off that client and they go on a long-term care private pay path. Medicare under Part A will also cover hospice services. These are end-of-life services that are offered to anyone that's eligible for Medicare. Lastly, Medicare Part A will cover home health services. These may include a nurse to come into the home, a physical therapist, an occupational therapist. Under Part B, this is considered the medical insurance component of Medicare. This helps cover doctor services and outpatient care. It also covers some preventative services to maintain a person's health and to keep certain illnesses from getting worse. Some of these may include screening for breast cancer, glaucoma tests, some durable medical equipment such as walkers or oxygen equipment. Generally, Medicare in Part B will only pay 80% of what Medicare has approved, and that means that you as the person receiving Medicare will need to pay that other 20%. Under Part C, this is called the Medicare Advantage plans. This is a way for people to get Medicare benefits through private companies approved by and under contract with Medicare. Some of these companies are such as group health, some HMOs, some PPOs. These programs or plans, if you may, include both Part A, Part B, and usually other benefits that Medicare does not cover. And some of these might be things like dental care, vision, other preventative services, and most of these plans provide a drug coverage. Then several years ago, Medicare added on what we call the prescription drug coverage. This component is usually run by private companies approved by Medicare, which can either be Medicare Advantage plans or separate Medicare prescription drug plans. They help cover the cost of prescription drugs. As you all know, or if you don't know, medications are very expensive, and so this is a way to help those over 65 cover the cost of medications. Each of these plans or private companies can vary in cost and drugs covered. So it's very important with any of these components that you as a consumer really study and ask the appropriate questions to understand what each part of Medicare covers and what it does not cover, and most important, what it costs. When you first reach the age of 65, you have two main choices for how to get your Medicare covered. The first one is called Original Medicare. This includes Part A and Part B. You have choice of doctors, hospitals, and other providers. Generally, you or your supplemental cover pay deductibles and co-insurance. You usually pay a monthly premium for Part B. This is normal for all Original Medicare. The second step to Original Medicare is to decide if you want a prescription drug plan. If you want this coverage, you must join and choose a Medicare prescription drug plan. These plans, again, are run by private companies approved by Medicare. Usually you can find in your local area the plans that are available to you. Step 3, you have to decide if you want supplemental insurance. I've already talked about the fact that Medicare will most likely pay 80% of the costs of your doctor or your test or your equipment, but what happens to the other 20%? Most people will find what they call a Medigap or a Medicare supplemental insurance policy from a private company. These companies then will support the 20% that you are charged. Secondly, you can join what we call a Medicare Advantage plan. This is like an HMO or a PPO or a group health. This also, we talked about this in Part C. Under this plan, you will have Part A and Part B, and usually you can use the doctors within the plans, you use the hospitals within the plans, and so if you went outside of that plan for another doctor, you would have to absorb the costs. These plans also have additional services that Original Medicare will not have. And so many people find these plans very attractive. The costs are usually ruled by the cost of the plan. And subsequently, you may also find that in these plans you will have the prescription drug coverage. There are other Medicare health plans that people can participate in. For example, there may be pilot programs or demonstration programs that Medicare is trying out and may be approved that you can look into. One that has been known in the past is called the PACE program. It combines medical, social, and long-term care services and prescription drug coverage for the frail, elderly, and disabled people. There are certain rules to be able to enter into these plans, and costs, again, may vary. Lastly, we have the Medicare drug plans. Medicare offers this coverage to everyone with Medicare. Oftentimes you may again need to go to a private company. There are two ways to get the Medicare prescription drug coverage. First, the drug plan. These plans add drug coverage to Original Medicare, like we talked about just before. And then secondly, the plans are put into the Medicare Advantage plans. As you can see, Medicare is not very simple, and people need more and more guidance as they go down this path. To learn more, though, about the different parts of Medicare, what Medicare will not and will cover, how much Medicare costs, I would suggest that you go to www.medicare.gov and select Find Out What Medicare Covers, or call 1-800-MEDICARE, and the TTY user should call 1-877-486-2048. Thank you for your attention, and I hope this has been helpful. These are really the ABC basics of Medicare. Do call 877-458-3767 for a Silver advisor to answer your specific questions on Medicare. Thank you.